following is an exclusive presentation of Cablevision local programming. TV that's close to home.
Sinusitis is an age-old problem that affects children and adults.
But there are new solutions for this common condition.
And ways to avoid it. We'll have the facts for you on this week's Health Talk.
We're coming up next.
Welcome back. We're back with Dr. Robert Weiss. He's an ENT physician, and he's helping us learn about sinusitis.
So, Rob, we were talking about the sinuses and how we make the diagnosis, and we have some x-rays to actually show our viewers so they can not only see where the sinuses are,
terrific.
but perhaps help us know what the sinuses look like in sinusitis. So what are we looking at here? It looks like something like a skull.
Right. That is a plain x-ray of the sinuses, and this is what was used pretty much up until the 1980s before CAT scan became available.
I remember this very well. This was the way we did in my day, make the diagnosis of sinusitis.
This is your board question.
This was the board question.
So you can kind of get the sense of where the eye sockets are, where the teeth are, and you can kind of see the outline of the sinuses.
Yeah, that triangular area towards the bottom is the mouth. You can actually see the tongue
open
at the
mouth,
bottom.
the tongue.
And then those air spaces to either side, I guess, are
Correct.
the maxillary sinuses.
Right. But it turns out when they studied these radiographs against, let's say, CAT scan imaging, the misdiagnosis on these was about 50%.
That's
So
really,
it was what we had, but it wasn't perfect.
It wasn't
I was
great.
misdiagnosing sinusitis 50% of the time in my day.
That's when you rely on your clinical judgment.
So we have a CAT scan image to show our viewers too here.
This is dramatically different.
Right.
And do explain this. This is like cutting the head with an egg slicer. So
Exactly.
This is a slice of
This
the brain.
is literally a slice of the image, and you can clearly see the two orbits or the eye sockets with the eyeballs in them. And all of that black area that you see, the two triangles around the cheeks where the arrows are and where the letter B is, that is the air within the sinus. So this is a normal sinus CAT scan. Those little arrows that are pointing on a diagonal way are showing you the narrow channels that we talked about.
Those are the drainage spouts.
Now, the other thing you'll note that those channels kind of go against gravity. If you imagine that there's fluid sitting in that sinus, the fluid actually has to go up to get out of those channels. And the reason for that is that the cilia, which line the sinus membranes, all direct fluid and mucus towards those channels.
Those almost microscopic hairs that move the mucus and the debris along.
You can really get a sense on this picture of how narrow those channels really are.
And those are wide ones. Those aren't pathologic. Those are normal channels there.
But it's really interesting because back in the old days, we didn't really fully appreciate that the cilia move the mucus and stuff out, so we thought we needed gravity to drain the sinuses.
And in fact, the old way of doing this was to make a hole in the sinus at the bottom.
I remember those days. Literally, chipping your way in.
Chipping your way in, using all sorts of what we consider today primitive instruments to make holes in the sinus. And it turns out that that wasn't really the best way to do it because you were going against what the cilia want to do. The cilia want to move it up to that one channel. And,
so our next picture is?
Well, the next picture is an intraoperative slide. And we could talk about some of the advances, but this is one advance making sinus surgery a lot more precise and a lot more safe. And this is an image guidance system. And this is essentially a GPS system for the surgeon. So real time, when I'm in the operating room, when I pass an instrument into the sinus, I can actually see that instrument appear on a map, which is the CAT scan.
So that screen that we see in the center is really the CAT scan,
right?
And it's viewing the surgery and showing you where your instrument is on that. That's an amazing advance. Do you find that big difference for you as a surgeon?
In select cases, it helps. I don't use it every time, but certainly a difficult case, a revision case, it's actually very helpful.
You've actually brought us some examples of older tools used to use in surgery to give our viewers some background.
Right. Yeah, the history of sinus surgery is fascinating, and I brought along some instruments just to show as an example, but these are some of the instruments that were used probably up until the 1980s, even early 90s. I used a couple of these in my training in the early 90s, and you can see that they're quite destructive. This makes a fairly large hole in the sinus, much larger.
You tell people what the old Caldwell Luck procedure.
Right.
I remember it again from my early days. But you used to go in through the mouth, right?
You would go up under the lip and literally make a hole through the front face of the sinus.
And this is when we believed the sinuses had to drain downward.
Because the sinuses had to drain down. We didn't appreciate the whole ciliary flow concept that
so
against
that
gravity.
device was actually...
this is called a Wiener rasp. It just sounds bad.
It really looks bad.
But
we
that
often
made a
use
hole, right?
That would make a hole. We also had large sort of chisel type things to, again, we're talking about big moves in removing bone.
And just to point out for the viewers, what you just did is what you really did in the operating room.
Literally. And any kind of an instrument that would grab and break bone. Because again, the sinuses are bone. At the end of the day, they're a bony structure, and the only way to make a hole in bone is to remove parts of the bone.
And this was to create a new drainage pipe because the old drainage pipe was clogged all the time.
And again, it was what you had,
it's
and
all there
people
was.
were suffering with pain, and it really did help people. But
a lot of patients got saved with these instruments, but as things moved along, the CAT scan was the main development that allowed us to really see what was going on. And the other thing that helped us and my predecessors was nasal telescopes and nasal endoscopy. Because now we could see it on a CAT scan radiographically, and we could use this type telescope, which is a rod lens telescope.
Now that's more than just a hollow tube, isn't it?
There's a glass lens that goes through the whole thing. It's magnified, and you connect this to a light source. I don't have that with me today. And a video system, and in high definition you can see everything within the sinuses.
On a screen when you're using
We're working off a screen typically.
And that goes, you don't have to go under the lip anymore.
Nope, this goes right through your nostril. So that's pretty much been the standard of care for the last 10 or 15 years, using telescopes, CAT scan imaging.
Now, just before we go on, you don't use that to break through the wall of the nose into the sinus, do you?
No, this is strictly just like when someone has a laparoscopic procedure to remove a gallbladder. This is allowing visualization.
It's almost like a small laparoscope for the nose.
This is a mini laparoscope for the nose, yep. And this has been around for at least 20 years. So those two developments have really helped bring modern sinus surgery into where it is today. Plus, the techniques have gotten better. We've learned that less is better. In the old days with the Caldwell Luck, you would go in, make a big hole, pull out any diseased lining you could find, and strip the bone of the lining, waiting for the body to regrow all that lining. Thinking
that question about that old procedure.
Right.
In the old days, you'd make a hole through the bone,
right,
and then you have all this pus draining over the bone. Why didn't the bone get infected?
Sometimes it did.
That's something called osteomyelitis, which is a bad infection.
That's a bad infection. And the other thing is when you strip all that lining, it's got to grow back. The big discovery a few years ago was that it's better to leave diseased lining, allow it to heal, and it actually costs less energy to regenerate than regenerating brand new lining.
So it takes a while for all that lining to grow back.
Months, sometimes years, and sometimes never, which leads to other problems. So the whole concept of less is better with sinus surgery really has taken on, and it's moved through different stages where we're doing just more strategic openings of sinuses, not doing as much in terms of bone removal, preserving the mucous membrane as much as possible.
Well, you know, we did skip over one, I think, very important question.
Yeah.
At what point do you make the decision to do surgery as opposed to just prolonged antibiotics, decongestants, et cetera?
That's a great question. There's a lot of criteria that are written down and that we follow. But generally, anytime, let's say for chronic sinusitis, anytime a patient has gone 3 months without improvement, and We're talking about multiple weeks of antibiotics, steroids, decongestants, allergy management, any other factor that we can control. If they failed that and they're still symptomatic, and they usually have some CAT scan findings.
That's going to be my next question. So it's both symptoms and findings on the CAT scan.
Right. Now, the patients that have recurrent acute sinusitis, their CAT scan may show some narrowing, but you're not going to see the same findings as chronic sinusitis. So we rely more on their history to decide if they're failing medical therapy. But the general answer is they failed medical therapy.
Now we have less than 2 minutes left, so we want to definitely get to the video. Okay. Tell us about that. This is sort of the latest and greatest.
Yes, this is the latest. This is the future. And this is called balloon sinuplasty. And now we can actually open up sinuses without removing bone. So what you're seeing is a catheter being placed into the sinus, and it's transilluminating the sinus. So that's how we know where it is. So in your
so you actually see the light coming through the skull.
And now the balloon, you saw the balloon open up that narrow channel.
Pushed open that channel.
And it actually cracks little micro fractures of that bone. So that's why the channel stays open.
Now, doesn't that cause more swelling and obstruction right after you do it?
Well, it's going to cause some. It's going to cause some, but compared to actual surgery where you're removing bone, the recovery from this, the ease in which a patient can go through this is much better.
Is the patient asleep while this is being done?
Right now, yes, but this technology is lending itself towards doing this in the office under local. In fact, that's where the government, Medicare, and some of the insurance companies have actually developed a reimbursement scheme so that you can stay out of the hospital.
That's amazing, and we've gone from these kind of blunt instruments to something very refined.
So this is the actual device, and I just wanted to show you. So Andrew, if you could hold that.
Just about a minute.
I'm going to inflate the balloon, and you can see it open up there. Yeah. So right now we're about 8 atmospheres. So if you want to feel how hard and firm that is. So a tire is about 2 atmospheres. This is about 8 or 10.
So this is almost like a snake that you might use in your plumbing, except that it's got that balloon that opens the...
Exactly.
So it's angioplasty.
It's angioplasty. Right. We're not leaving anything behind like a stent, but once we go in and dilate the channel, we retrieve it, and the channel remains open. And the studies are showing that this is as good, and in some cases better, than traditional surgery, with much less downtime for the patient, and hopefully being able to do it without anesthesia is a big plus.
Way to end this. We've run out of time, but with such a minor and well-tolerated procedure, it's great to hear that I don't have to undergo the Caldwell luck.
Terrific advance.
That always seemed absolutely horrible. If you have a question you'd like to ask on TV, on Health Talk, please contact Andrea and me at healthtalk@norwalkhealth.org.
We'd like to thank our guest today, Dr. Robert Weiss. We've learned some great information about sinusitis.
We'll see you
next week on Health Talk.
Bye-bye.